Hi, this is Dr. Surapaneni. The topic for today is upset stomach. All of us have felt or gone through symptoms of stomachache, cramps, feeling bloated, gassy, belching a lot, feeling nauseous, and sometimes even rarely having diarrhea. These symptoms, more often than not, could be a sign of indigestion. It's important to distinguish indigestion from dyspepsia. Dyspepsia is usually due to underlying cause like peptic ulcer disease, which can be associated with epigastric pain, heartburn, early satiation, feeling full, some nausea or vomiting. So the category of symptoms that we discussed earlier, stomachache, cramps, bloating, feeling gassy, nausea, even sometimes rarely diarrhea, can be classified as functional dyspepsia, which excludes specific symptoms related to peptic ulcer disease. We can break down causes into categories like, is your indigestion due to eating fast food, greasy, fatty food, or eating too much and too fast? Did you eat food that's contaminated with mold, viruses, or bacteria? I know, sounds nasty. Or are you going through a lot of stress, anxiety? Have you been smoking or drinking too much alcohol? Did you just get back from an international travel? All of these categories could be responsible for your upset stomach symptoms. Also, it's worth mentioning that your mind can truly affect your body. Emotional stress can result in exacerbation of your acid reflux symptoms like heartburn, epigastric pain, burning sensation, metallic taste in your throat. Other factors can include smoking excessively, drinking alcohol. Testing in patients who don't have family history or significant comorbidities or an immunocompromised state is not needed. Generally, we want to triage patients based on their age, risk factors, and then consider testing. A good general rule of thumb that I follow in my practice is if a patient is 50 years or older and has had symptoms of acid reflux, they've been losing weight, or they've tried over-the-counter medications and still don't have adequate relief, these patients should definitely be screened via endoscopy to explore further. Gastroenterologists are worried about a bacteria called Helicobacter pylori, which is more prevalent in third world countries where water contamination and dysentery is extremely high. This bacteria can be passed via oral transmission, through saliva, through contaminated food, contaminated water, usually acquired during childhood. When infected with H. pylori bacteria, a person can develop chronic gastritis, thereafter dysplasia of the stomach lining, and eventually it can lead to gastric cancer. As we already know, H. pylori causes gastritis, ulcers of the stomach and duodenum, so when a gastroenterologist looks inside your stomach with an upper endoscopy, they usually take biopsies of the stomach lining and the upper part of your intestines called duodenum to see if you're positive for H. pylori. Other forms of tests include urea breath tests, which can detect current or past infection, antigen tests of stool. Treatments for upset stomach are often supportive. Generally, treatments with Pepto-Bismol, hydration with fluids containing electrolytes. I usually recommend low-carb Gatorade, coconut water, Pedialyte, etc. Eating bland foods like applesauce, toast, bananas, rice until your stomach feels better. And sometimes you may benefit from anti-acid reflux medications like famotidine or Pepcid omeprazole or Prilosec to help decrease symptoms of GERD like heartburn, burning, epigastric pain. Some other treatment approaches include treating underlying problems like H. pylori bacteria-related gastritis, ulcers. We can also consider low tricyclic antidepressants, which have been shown to have a positive effect on functional dyspepsia, and eating small, frequent meals, sticking to a low-fat diet, cutting out tobacco and alcohol use. In summary, remember, most patients who have symptoms of stomachache, bloating, nausea, discomfort are usually dealing with functional dyspepsia, which is not related to peptic ulcer disease. And these type of patients can generally be treated with over-the-counter medications like Pepto-Bismol, hydrating, eating a low-fat diet, eating small, frequent meals, and resting.